Hi, my name is Jenny Solaro Andrews, and I'm going to walk you through my process of usability testing and prototyping for my custom-built application called Insight App. When behavioral health patients do not take their medications as prescribed, they are at increased risk of readmission. I hypothesize that if we increase medication adherence in the outpatient basis, we can better manage patients without readmission. To assist in this management, my project will leverage ingestible event marker technology and a supporting smartphone application. The application is designed to interpret the data that is sent from the event markers so that patients and providers can track adherence and other physiological metrics which indicate whether or not the drugs that are prescribed are working as intended. The application will be called Insight Out, as it leverages insight gleaned through technology in an effort to keep patients out of the hospital. To be most effective, patients and providers must want to use the technology, so it has to be easy to navigate and perceived as providing value. The two-phased usability testing that I will discuss next was intended to make sure that my plan in its entirety made sense and that my application in particular is user-friendly. This diagram will provide you with a little bit of context as to how my innovation works. First, patients receive their prescriptions and a wearable sensor. Their medication prescription is filled by a specialty pharmacy which encapsulates their pills with ingestible event markers that are about the size of a grain of sand each. Once the pill is ingested and reaches the stomach, the event marker sends a signal to the wearable sensor, which in turn transmits the time of ingestion along with other physiological data like blood pressure, steps taken, sleep hours, etc., to the patient's smartphone. At regular intervals, the smartphone securely transmits the data to a database stored on a cloud. The database then aggregates data for viewing through two portals, a patient portal and a provider portal. In my first phase of testing, I conducted a telephone interview with a former ED clinical colleague. My interview questions were structured to test the concept driving my innovation and my deployment strategy. You can see those on the screen. I asked her to think about my questions from the perspective of an ED healthcare provider. First, she agreed that increasing medication adherence on an outpatient basis would be effective in keeping patients out of the ED or from being admitted as an inpatient. She felt that stabilization of drug levels and better disease management was both better for individual patients and the broader society. Though my original plan had been to screen patients when they were being discharged from inpatient hospitalizations that were related to medication non-adherence, she suggested that I also consider screening and consenting patients in the ED. To increase the chance that patients would engage, she recommended collaborating with psychiatry resources, including psychiatrists, social workers, and resource nurses. She confirmed my belief that paranoid patients are not likely good candidates for this program and suggested that I consider implementing some sort of assessment at the time of screening to identify patients with any underlying paranoid delusions. In the second phase of testing, I generated a paper prototype of both the patient and provider versions of the application. My user was my husband, Jim. I asked him to go through first as a patient and then as a provider managing that patient's care. The goal of the prototyping exercise was to evaluate ease of use, perception of the value of the system, utility, and efficiency. Because there are so many possible pathways through the application, I decided to utilize a closed task methodology. This means that my prototype was designed to test specific common functionalities like logging in, email functions, setting an alarm, and drilling into results. Now let's watch the video.
First, we're going to log in as a patient. We're going to manage. Submit. All right, now we're going to log in as a provider.
user reported a high-quality user experience. He described the application as intuitive with a smooth customer interface. In addition, he liked the visual management technique of color coding to indicate normal, cautionary, and abnormal results. He felt that the application successfully leveraged common smartphone navigation techniques, which was helpful. In terms of critiques, he felt it was not immediately obvious how to use the application to contact providers or patients. He also inquired how the application knew his weight, since this is not a data element that is recorded by the wearable sensor. I had actually imagined that this information would be entered by the patient, but did not provide them with a mechanism for doing so. Finally, he suggested that the alert system integrate outpatient appointments, such that missed appointments are flagged in the same way that missed dosages are. This is a great idea. In conclusion, both exercises were very helpful in increasing the potential value of my innovation. The act of building my prototype forced me to deconstruct my overarching concept into very specific details, and both users pointed out where things that seemed obvious to me were maybe not so obvious to others. Thank you.